Welcome to the OmniDental Podcast, presented by OmniDental in MedSpa in Arlington Heights. This is where we do a deep dive into specific topics, really pulling out the key insights so you get the important stuff fast. Today, we're looking at something that can make a big difference for a lot of people. Microneedling for acne scars. Now, if you're not familiar, OmniDental and MedSpa, they're right here in Arlington Heights, Illinois. They serve the surrounding areas too, Buffalo Grove, Palatine, Schaumburg, the whole region. They offer really comprehensive care, everything from general and cosmetic dentistry with Dr. Bola's Poles, DDS, all the way to advanced aesthetic treatments. It's all about, personalized care, making sure you're comfortable using the latest tech, a real patient-first approach. It's kind of a holistic view, isn't it? Seeing how dental health and skin health connect.
Exactly. And that's what's so interesting and really relevant for today. How practices like OmniDental and MedSpa are looking broader now. They get that feeling good, your overall confidence. It isn't just one thing. Microneedling sits perfectly into that. It shows their commitment to offering these top-tier aesthetic services right alongside the dental side.
Absolutely, yeah. It makes perfect sense. I mean, acne scars can really impact how someone feels day to day. So for our deep dive today, let's really get into it. What is microneedling for acne scars exactly? And, how does it actually work underneath it all?
Okay, so at its heart, microneedling is, it's quite elegant in its simplicity, but very effective. You often hear it called collagen induction therapy. That name gives you a pretty big clue. It's basically a minimally invasive cosmetic procedure. It uses these tiny sterile needles to create what we call controlled microinjuries on the skin's surface. Think of it like creating very small, very deliberate channels.
Okay, and this is the part I find really fascinating. It's not about adding something to your skin, is it? It's about triggering something within it. You're essentially, kind of nudging your body, prompting its own natural healing response.
Precisely. That's the key insight. These tiny controlled injuries, they act like signals. They tell your body's natural repair systems to, kick into overdrive. And the biological result, a really significant increase in producing collagen and elastin. These aren't just fancy terms. They are the absolute foundation proteins for skin structure, elasticity, that smooth, healthy look. Collagen helps fill things in. Elastin gives it bounce back. And a big plus, it's generally suitable for almost all skin types and tones, which isn't true for every treatment out there.
That makes sense. Knowing how it sparks that internal repair, what does the session actually feel like? If someone's thinking about this, what's the experience at OmniDental and MedSpa?
A typical session is actually pretty straightforward, and it's really designed with comfort in mind. First step, the practitioner cleanses your skin thoroughly. Gotta have a clean slate, obviously. Then they apply a topical numbing cream. This is really important. It minimizes any discomfort, makes the whole thing quite tolerable for nearly everyone.
Okay, numbing cream, that's good.
Yeah. Once that's taken effect, they use a specialized microneedling device. It often looks like a sort of pen with these very fine needles at the tip. They carefully glide this device across the area being treated, creating those precise, controlled little punctures we talked about. Most people describe the feeling as maybe a light vibration or perhaps a bit of pressure, but painful? No, not really, thanks to that numbing cream. And this process, even though it sounds simple, it immediately starts that healing cascade we mentioned. So over the next few weeks, as your skin repairs itself naturally, it's working overtime, building up that collagen and elastin. And the result you see over time is skin that looks smoother, feels firmer, and those acne scars, they become less noticeable as new, healthy tissue kind of fills them in.
And I've heard you can sometimes boost this even further. Clinics sometimes combine microneedling with something called PRP, platelet-rich plasma. What's that about?
Oh, absolutely. That's a great point. That's where treatments can get really personalized and, supercharged. So, platelet-rich plasma, PRP, it's this potent serum that's actually made from your own blood. They take a small blood sample, just like a regular blood test. Then it's spun in a centrifuge. This separates out the platelets and, crucially, the growth factors. These are then applied right onto your skin immediately after the microneedling.
Okay, so using your own body's resources.
Exactly. And the reason it works so well together is those microchannels from the needling. They act like direct little pathways. They let these powerful growth factors penetrate much deeper into the skin than they normally could. PRP is just packed with signals that tell your skin to repair faster, build even more collagen, and just generally regenerate more effectively. It's like giving your body's healing team a massive turbo boost. You often see faster and sometimes even more dramatic results.
Wow, okay, that sounds powerful. So if someone decides to go for this, what's the typical time frame? Like, how many sessions are we talking about? When do you actually see the difference?
Right. Well, patience and consistency are definitely part of the process here. Microneedling isn't, a one-shot deal. It works gradually, relying on your body's pace. The number of sessions needed really varies. It depends heavily on how severe the acne scars are and just how your individual skin responds. But generally speaking, most patients start seeing some noticeable improvement after maybe 3 to 6 sessions. And these appointments are usually spaced about 4 to 6 weeks apart. That gap is important. It gives your skin time to heal properly, regenerate, and build that new collagen between treatments.
So it's a cumulative effect then.
Exactly. And what's really great is that the benefits keep developing. Your body continues the collagen building and remodeling process for several months after your last session. So the improvements in your skin's texture and the look of the scars, they actually continue to get better over time. Each session builds on the one before it.
Okay, so the million-dollar question then. Does it really work for acne scars? We understand the science now, but what's the real-world outcome? Is it legit?
Yes, absolutely. It really does deliver. Both clinical studies and just tons of real-world patient experience, they consistently show microneedling is highly effective for improving acne scars. It tackles the problem in a few ways. It helps physically fill in those indented scars. It smooths out that rough, uneven texture. And it's also really good at reducing post-inflammatory hyperpigmentation.
Ah, those dark spots that linger after a breakout.
Exactly, those stubborn marks. Microneedling helps fade those too. Now, sure, effectiveness can depend on things like your specific skin type, how deep or what kind of scars you have. We can touch on that more later. And of course, how well you follow the aftercare advice is crucial. But the vast majority of people who complete a series of treatments, they report really significant visible improvements, better skin tone, smoother texture, and definitely reduced scarring.
And I think that appeal of using your body's own healing power without injecting foreign stuff, that's huge for a lot of people. It feels more natural.
It does. It's prompting your skin to optimize its inherent abilities.
So who's the ideal person for this kind of treatment? Who should be thinking, yeah, this might be for me?
Microneedling is generally pretty safe and works well for a lot of folks. The ideal candidates are usually people with what we call rolling scars, those sort of wavy depressions, or shallow boxcar scars. Those are the more defined, indented ones with sharp edges, but not super deep. These types respond really well to the collagen stimulation. It's also excellent if your main concern is that hyperpigmentation we mentioned, or if you have enlarged pores, or just generally rough, uneven skin texture left after acne. But a key thing is your skin needs to be generally healthy at the time of treatment. No active infections, no big inflamed breakouts happening right then.
Okay, so active acne is a no-go.
Right. Treatment usually needs to be delayed if you have active acne or other inflammatory conditions like active eczema or rosacea in the area you want treated. Also, it's generally not recommended during pregnancy. It's all about safety and making sure the conditions are right for optimal healing and results.
Which really highlights why you need professional advice, doesn't it? This isn't something you just, order online and do yourself. You really need to talk to a licensed specialist like at Omni Dental and MedSpa to see if it's right for you and get that tailored plan.
Oh, absolutely essential. A personalized plan is key to getting the best results. When you have a consultation, say, with the team at Omni, they'll look closely at your skin, really listen to your concerns, and then map out a treatment schedule that makes sense for you. Like we said, usually multiple sessions spaced out with the frequency based on your skin's specific needs and how it's responding. And they'll also prepare you for what to expect right after. It's normal to have some mild redness, maybe a bit of swelling, kind of like a mild sunburn feeling. That usually just lasts for a day or two. Your skin's just had a bit of a workout.
And that aftercare piece sounds just as important as the treatment itself for getting those good results. What are the main things to keep in mind afterwards?
Critically important.
Yeah, the sources mention things like avoiding makeup and sun exposure for the first day or two.
Correct. Usually 24 to 48 hours. You want to let the skin breathe and heal initially. Stick to really gentle cleansers and moisturizers that your provider recommends. Nothing harsh. Staying well hydrated by drinking plenty of water helps the healing process from the inside out. And sunscreen is non-negotiable. A broad spectrum SPF daily is crucial to protect that new healing skin. It's extra vulnerable initially.
And no picking, right? Resist the urge.
Definitely. Avoid picking, scratching, or even just touching the area too much. Let your body do its work undisturbed. Following that aftercare diligently really supports the healing and makes a big difference in the final outcome.
Okay, makes sense. So to give people the full picture, let's quickly touch on the pros and cons. What are the main advantages?
All right, pros. Number one, it stimulates your own natural collagen and elastin. Big plus. It demonstrably reduces the appearance of many types of acne scars. It's suitable for pretty much all skin tones, which is a major advantage over some light-based therapies. It's minimally invasive, meaning recovery time is relatively short compared to more aggressive options. And as we talked about, you have the option to combine it with PRP for potentially even better results.
Okay, and the downsides.
The cons. On the con side, it does require multiple sessions. It's an investment of time and commitment, not an instant fix. You can expect some minor temporary side effects, that redness, maybe some slight swelling or flaking for a day or two. There's a small risk of irritation or maybe not getting the best results if the aftercare isn't followed really carefully. And as we mentioned, it's not for everyone specifically, not for people with active acne outbreaks, certain skin conditions, or during pregnancy.
Got it. So, yeah, not a magic wand, but definitely sounds like a solid, effective option that works with your body for improving acne scars. How does it compare, say, to laser treatments or chemical peels?
That's a good comparison to make. It really holds its own unique place. Take laser resurfacing. It can be very effective, sometimes even more dramatic for certain deep scars, but it often involves more significant downtime, can be quite a bit more expensive. And lasers aren't always the best choice for darker skin tones because there's a higher risk of pigmentation issues afterwards.
Right, and chemical peels.
Chemical peels are great for surface issues like texture irregularities and pigmentation, those dark spots again, but they generally don't go deep enough to make a huge impact on more indented or significant scarring. And then there's dermabrasion, which is an older technique. It's much more aggressive, involves physically abrading the skin, and carries a higher risk of irritation and longer recovery time.
So where does microneedling fit in that landscape?
Microneedling kind of hits a sweet spot for many people. It balances effectiveness across a decent range of scar types with minimal downtime and gradual, very natural-looking results. Because it's working with your body's healing, the improvement looks like your skin, just better. It's often seen as an excellent choice for people wanting a less invasive approach than lasers, but something more impactful for scars than superficial peels, especially for stubborn scarring without that intense recovery.
That balance sounds really appealing. Okay, let's get practical for a moment. Cost. What's the typical range for these treatments? And maybe we can run through a couple of quick FAQs people often ask.
Sure. Cost-wise, microneedling sessions generally range somewhere between, say, $200 and $500 per session. This can vary based on location, the specific provider, and maybe if PRP is included. Often, clinics like Omni Dental and MedSpa will offer package deals if you commit to a series of treatments, which usually brings the per session cost down. And while, yes, there's an upfront investment, you have to consider the long-term value. The results can last for months, even years, especially with good skincare maintenance and sun protection. It's really an investment in restoring your skin's health and your confidence.
Okay, good to have a ballpark. Now for those quick FAQs, just to recap clearly for everyone listening. In simple terms, what is microneedling for acne scars again?
Okay, simply put, microneedling for acne scars is a minimally invasive treatment using fine needles to create tiny, controlled injuries in the skin. This action triggers your body's natural healing response, boosting the production of collagen and elastin. These proteins then help rebuild the skin structure from within, smoothing out scars, improving texture, and evening out tone. It's basically helping your skin repair itself better.
Got it. And the timeline for seeing results on those scars, how long does that usually take?
Right, visible improvements typically start showing up after about 3 or 4 sessions. Remember, those are usually spaced 4 to 6 months apart. But the key thing is, collagen remodeling continues for several months after your last treatment. So the final results unfold gradually. Patience and sticking to the plan are really important.
Okay, and we touched on this, but just to be clear, does it work for all types of acne scars?
It's most effective for the shallower types. So those rolling scars, the wavy ones, and milder boxcar scars, those defined but not super deep indentations. These respond really well because the new collagen generated can effectively plump up and fill in those depressions. For very deep, narrow scars, like ice pick scars, microneedling alone might not completely erase them. It can help, but often. A combination approach might be needed for the best results on those really deep ones. Maybe microneedling plus PRP, or sometimes combining it with other modalities like specific peels or even targeted laser treatments. And this is exactly where having an expert consultation is vital. Someone like DK Abduli, who's the cosmetic aesthetics director at Omni Dental and MedSpa, she has deep expertise in all these advanced skin treatments, including complex acne scar cases. She can really assess your specific scars and recommend the most effective strategy, ensuring it's personalized and results-focused.
That makes sense.
Sure.
So it sounds like if you've been dealing with the aftermath of acne, the texture, the marks, microneedling really does offer a safe, effective, and quite natural way forward. It leverages your own body's healing, boosts that crucial collagen, and helps improve your skin's overall look and feel without harsh interventions or a lot of downtime.
Absolutely. We'd really encourage anyone listening who's bothered by acne scars to explore it further. The best way to know if it's right for you is to schedule a consultation with a skincare expert. At Omni Dental and Med Spa, they can properly assess your skin, discuss your goals, and create that tailored plan.
And taking that step is easy. You can schedule an appointment at Omni Dental and Med Spa by calling them at 847-483-8833. That's 847-483-8833, or you can book online through their website.
You know, this whole conversation really makes you think, beyond just tackling symptoms like scars, how much more potential could we unlock for our health, our well-being, our confidence, if we focused more on understanding and truly working with our body's own incredible, often underestimated natural capacity for healing and regeneration?